Hey guys, welcome back to another Midnight Mental Talk. I'm Leanne and this is Adrienne. We're here to talk about another form of depression. Now, 20% of Canadians actually will experience mental illness at some point within their lives, but today we're going to take a look at seniors specifically. For us, at our age, we would assume that as we get older, we may get more depressed, right? Like, you retire, then you're like, what do you do with your life? You may get some form of illness later on. We're the same age, so, you must think of aging. And would you assume that you would be could possibly be more depressed as you get older, or not?
I would figure you'd be a little more susceptible to getting depressed later on.
I'm glad you said that because apparently it's the opposite. Mood Disorders Society of Canada says, according to Health Canada, older Canadians are healthier, more affluent, are living longer and more independent lives than ever before. And seniors are physically more active, are engaged with their families and in their communities, and are becoming international globetrotters. They're challenging many of the negative stereotypes we hold about aging, are showing us that life is for living with vigor and vitality. However, it is true that some seniors will struggle with some type of mental illness from time to time. For seniors living out in the community, it's estimated that 5 to 10% will experience a depressive disorder that is serious enough to require treatment. And the rate of anxiety and depression dramatically increases to 30 to 40% for seniors living in institutions. The question they ask is, why aren't seniors getting the help that they need? And apparently depression in the elderly can be very difficult to recognize.
Yeah, there was actually how you said about how depression is difficult to recognize in seniors. It's mainly one of the things I found was that you could confuse dementia with depression or grieving with depression, because as we get older, we're more likely to lose people that we're close to as opposed to when we're younger. So the two of those could be very well looked into. Okay. But at the same time, you have to rule out all of these things just to be sure. And I do have signs and symptoms. A lot of them are very similar to other forms of depression. You have sadness, fatigue, abandoning or losing interest in hobbies or other pleasurable pastime. You have social withdrawal. To come with, the possibility of losing your close friends and your relatives, whatever, because you might not feel like you're capable of making new friends at an older age. You lose weight or you lose your appetite, which would come with weight loss. Sleep disturbances, you have difficulty falling asleep, staying asleep. Daytime sleepiness, you have loss of self-worth. You feel like you're worried about being a burden or feeling of worthlessness and self-loathing. You increase the use of alcohol or other drugs. Fixation on death and suicidal thoughts or attempts, which, it does make sense when you're older. You think about suicide because you feel like you might be a burden to your family or your friends and you don't want to be that person because of your ailing health. Those were the signs and symptoms. However, as I was reading it, they did say that a lot of seniors, going through the information about seniors, it said that a lot of seniors actually say that they don't feel sadness with their depression. They just feel as if they have no motivation, lack of energy, or physical problems. And so they don't actually feel sad, they just feel blah, kind of. In fact, they say physical complaints such as arthritis pain or worsening headache are often the predominant symptoms of depression in elderly.
Here are the risk factors that can increase depression in seniors, and they include the presence of other illnesses, some medications, living with chronic or severe pain, living alone without a supportive network, the recent death of a loved one, like you did mention, also having a fear of death, previous history of depression, and a family history of major depressive disorder, and a past history of suicide attempts. So those are the risk factors. And I want to also give you the illnesses that can increase the risk of depression in seniors as well. They include heart problems, including having a stroke, low thyroid activity, a lack of vitamin B12 or folic acid, low blood pressure, arthritis, cancer, and diabetes. Many commonly prescribed medications are also associated with depression, such as blood pressure medications, beta blockers, steroids, digoxins, and sedatives.
I have a few to add to the two things that you mentioned. Another one was lupus, multiple sclerosis, dementia, and Alzheimer's. And then the prescription drugs, beta blockers, sleeping pill, tranquilizer, calcium channel blockers, medication for Parkinson's disease, also medications, heart drugs containing risperidone, steroids and high cholesterol med, painkillers, and arthritis drugs, and estrogens. There's your list. Oh, apparently if you increase your alcohol consumption, you can increase your depression.
But doesn't that happen at any age?
I think so, yes.
Here's what works for avoiding depression for anybody, but especially seniors. Build social supports. In other words, make sure you have friends. There's also talk therapy. Psychotherapy apparently can be very helpful in dealing with losses, solving challenging problems, or dealing with the social impact of depression. There's also cognitive therapy. We've talked about that. If you want to know more about cognitive behavioral therapy, please check out a previous episode of ours, which is listed in the description box below. And they also suggest electroconvulsive therapy, ECT, which is a treatment that uses electrical impulses to change the chemical balance in a brain. I didn't know we still did that. It is often a last resort for patients who have not responded to other forms of treatment, who remain a suicide risk, or have other serious medical conditions that prevent the use of medication. It does remain controversial, so it is important to do your research so you can make an informed decision before having this procedure done on you.
It is a very controversial topic for sure. They don't do it as often as they could, as they have been in the past, but it has been very effective, and it doesn't surprise me that it can still be given to older adults and seniors.
As a senior, you should also consider taking multivitamins every day if you don't already do that. Keep healthy foods easily available. Choose whole grain and enriched grain foods. Eat fresh foods over manufactured foods. Choose dark green and orange vegetables more often. Lower the fat level in your milk and choose leaner cuts of meat. Consider chicken, fish, dried beans, and lentils as an alternative to red meat. Also, the obvious one, drink plenty of water.
Yeah.
Take care of your use of alcohol, like Adrienne said. Strive for a healthy body weight, like Adrienne said, and use Canada's food guide as a reference to healthy eating.
If you are not one that believes in the Canada food guide, then get a referral to a dietitian and they will gladly help you find the right diet and healthy eating plan for you and your lifestyle. If you and your family member are trying to figure out whether or not you might be suffering from depression or maybe possibly dementia, this is the division. The symptoms of depression, mental decline is relatively rapid, knows the correct time and date and where he or she is, difficulty concentrating, language and motor skills are slow but normal, and you notice or worry about memory loss or problem. So that's the symptoms of depression that you can notice. And the other spectrum, which is the symptoms of dementia, mental decline happens slowly. You become lost in a familiar location, difficulty with short-term memory, writing, speaking, and motor skills become impaired. You don't notice memory problems, or you don't seem to care, or your partner or your family member don't seem to care. So if you notice these symptoms, then I would certainly definitely go to the doctor. The alternative medicine for depression in older adults and the elderly, omega-3 fatty acids may boost the effectiveness of antidepressants or work as a standalone treatment for depression. St. John's wort can help with mild or moderate symptoms of depression, but should not be taken with antidepressants.
Okay.
Folic acid can help relieve symptoms of depression when combined with other treatments. And SAMe, may be used in place of antidepressants to help regulate mood, but in rare cases can cause severe side effects.
You can also go to mooddisorderscanada.ca and learn a whole lot more than we've said here today, which I advise you to do.
Alright, well, thank you guys for sitting and watching us discuss seniors' depression or depression in seniors. Hopefully we have told you some really interesting things and maybe had perked your interest in finding out more, especially if you have a family member or yourself have been experiencing some of the symptoms we have mentioned. If you like the video, click like. If not, well, there's the other button, but click like instead. If you want to hear more from us, be sure to press the subscribe button for us. and tune in every week. We try and aim for every Wednesday. Yes, come back next week and we'll be starting our, like Leanne said, our 3-part series on eating disorders. Chances are it's going to be every week for 3 weeks because it's a very heavy topic. So if you guys have any questions about eating disorders, leave them below and we'll be glad to look them up for you and find out the answer. So thank you for watching.
Bye!
Bye!